What in your body is involved in over 300 reactions? It's magnesium. We need magnesium for so many different parts of our bodies. And when we're taking prednisone, it's terrible because prednisone is stealing magnesium. So there are 300 chemical reactions that are supposed to be happening in our body that are being suppressed because we don't have enough magnesium. Hi, I'm Dr. Megan, your prednisone pharmacist. I'm here to talk to you all about prednisone and magnesium. And I just barely got my shipment of magnesium in the mail. Let's check it out. Hey, check it out. I got magnesium glycinate. I have a family member whose therapist suggested this to help out with anxiety. So I got it and we're going to supplement. So why in the world do we care about magnesium and prednisone? Well, I just gave you a hint. Anxiety is one of the main reasons. People on prednisone can have anxiety come out of nowhere and feel just terrible, just shaking and heart palpitations and feel like they're going to have a heart attack or die or something. So bad anxiety. And potentially it has to do with magnesium or other chemical changes in the brain from the prednisone, fight or flight hormones out of whack. It's really hard. So that's the first sign of low magnesium I wanted to share with you. Second, low magnesium, you can see it with abnormal heart rhythms. So weird, like thump, 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 thump. It's just not the way it's supposed to be. You can actually give somebody an arrhythmia by injecting them with way too much magnesium. So we don't want to have too much or too little. We want just the right amount. Feeling serious fatigue and weakness is a sign of low magnesium. Low calcium blood levels, called hypocalcemia, can be a sign of low magnesium because calcium, magnesium, and potassium are all related. They all kind of look similar in the blood. They're all positive ions. And so when your blood and your cells push one out, they take the other. They kind of go back and forth. And so it's this beautiful dance that your body has between calcium, magnesium, and potassium. And if they don't have the right ratio, then you can have all of them wrong. So we want to keep them in the right balance. And even one more thing I wanted to share about that is if you get your blood tested and you find out how much magnesium is in your blood, and by the way, a normal level is between 1.3 and 2.1 milliequivalents per liter. If you get it tested and you're like, well, it says it's normal, I don't have low magnesium, that is a trick answer because magnesium is mostly stored in your bones and your muscles. Like 60% of magnesium is in your bones and 40% is inside cells. So you can't measure that in your blood test. You can only measure what's floating around in the water part of the blood, which means there's only like 1% of the magnesium of your whole body is floating around in your blood. So when you're testing, you're only testing that 1%. You're not finding out how much is in your bones or how much is in each individual cell. So your body tries to keep the balance in your blood just right, but it could be stealing from your bones to get the blood at the right balance. Yeah. So that's why hypocalcemia is a problem. Then loss of appetite. So anorexia, not feeling hungry because that can happen because of low magnesium. Muscle cramps and contractions. So that happens to me. I wake up, especially like when I'm pregnant. I'm not right now, but when I'm pregnant, I can have serious Charlie horses late at night in my bed. And it's often because my baby is stealing my magnesium and I have low magnesium. So I'm having miserable muscle cramps. And so whenever I'm pregnant, I always supplement with magnesium. Nausea and vomiting is another symptom of low magnesium. And then numbness. So we need magnesium and it is so important. Those are just the signs of low magnesium. Those are the things you can actually feel and see that it's low. But what about when it comes to prednisone? What are the signs that we are having low magnesium with prednisone. So I already mentioned the anxiety, the mood, and having the proper balance of magnesium can help you have a more cheerful demeanor, having more positive emotions. When you're low on magnesium, you can feel anxious or depressed or otherwise feel unwell emotionally. And then the next important thing is prednisone is a glucocorticoid. Gluco sounding like glucose, which is sugar, and sugar is related to insulin. And so when we have prednisone, it causes high blood sugar, which causes insulin problems. And magnesium can help keep the insulin in the right balance. Yeah, so we need to give magnesium back to keep our blood sugars stable. Okay, then magnesium is also important in blood pressure. So your heart having the right amount of blood pressure, not too much and not too little, just the right amount. Then when we give back magnesium, I'm going to tell you 7 things that magnesium helps with. First, it helps boost your mood, right? I already mentioned that several times. So it boosts your mood. Second, it protects against inflammation. And a lot of people are taking prednisone for inflammation because prednisone's an anti-inflammatory. So if you give back magnesium, that can help prednisone in doing its job, right? Because prednisone's bringing down inflammation. Magnesium, if you give it back, will help prednisone bring down inflammation. Third is it reduces insulin resistance. And I already mentioned how prednisone is causing high blood sugars. And so if we give magnesium back, it can bring those blood sugars down, which can bring down the insulin resistance. We do not want to get diabetes. Number 4, it can help to manage blood pressure. Prednisone, you are 4 times more likely to have a cardiovascular side effect if you are taking prednisone than if you are not taking prednisone and have a normal condition that would cause you to take prednisone. So one of the main reasons that the heart problems happen is because prednisone causes high blood pressure. So let's give back magnesium, bring the blood pressure back down, right? Okay, number 5, it improves athletic performance. So I know a lot of people on prednisone, athletic performance is like the last thing on your mind. At least it kind of was for me. My doctor wouldn't even let me exercise because she was afraid if I got in an accident, I would just bleed to death. So even though this might not be important to you right now, maybe when you're off prednisone, improved athletic performance would help. Number 6, and this is the reason that has the very highest level of scientific evidence supporting it, is that when you give magnesium, it can help with migraines. That magnesium actually is more effective than dexamethasone, metoclopramide, and other prescription treatments for migraines. So migraines could be caused by magnesium deficiency. So take magnesium if you're struggling with migraines. And number 7, it reduces PMS. So premenstrual syndrome. It can help with the mood, with the bloating. It can help keep us more happy and less bloated while going through PMS. So all of those 7 reasons are why people should generally take magnesium, not to mention the fact that it's involved in 300 reactions, right? So what other medications besides prednisone can deplete magnesium? And the answer is a lot. There are a lot of medications that can deplete magnesium. So first, the medications people take to block stomach acid, whether that's a PPI like pantoprazole, or whether it's another type of medication like cimetidine, they can lower your magnesium. Other antacids like calcium carbonate, like in Tums, that can lower your magnesium. Antibiotics lower magnesium. Antivirals, blood pressure drugs, cholesterol agents, not statins, but other ones like cholesterol, steroids, not just prednisone, but all of the steroids, including inhaled corticosteroids, like in an inhaler, fluticasone, they all can do it. Hormone replacement therapy for older women or oral contraceptive pills for younger women. The estrogen containing products can deplete magnesium. Immunosuppressants like tacrolimus or cyclosporin. So if you're taking prednisone for a kidney transplant, it's not just the prednisone, but it's the immunosuppressants too that are depleting magnesium. Anastrozole, raloxifene, tamoxifen, and those are the prescription drugs. And then alcohol, coffee, a high sugar diet, and malabsorption from conditions like Crohn's disease. All of those, if you also are taking those medications or also have those complications, then your magnesium is probably being very depleted and you need to be replenishing it. So what's the best way to replenish magnesium? It's by eating it in food. And the highest source of magnesium is pumpkin seeds. Yum. In Spanish, they're called pepitas if you roast them. So pumpkin seeds are really high in magnesium. Dark chocolate, yes, is high in magnesium. Cashews, spinach, almonds, buckwheat, peanuts, black beans, bananas, and avocados are all high in magnesium. And how much do you need? Well, somewhere between 300 and 400 milligrams is the recommended daily value for men and women. Women at around the 300 milligrams and men at the higher 400 milligrams range. And then there's lots of different kinds of magnesium, right? Like if you go to the pharmacy, you could actually get a prescription version and you wouldn't be using that probably for just replenishing what's being stolen. But there's a lot over the counter. Some of them are for constipation, for like you can swallow a whole, like guzzle a whole bunch and it'll clear you right out. Others are just for nausea. They can be used for many things. The most common salts are probably magnesium oxide and magnesium glucinate. But what is the best kind for people on prednisone? And I would say it's probably the kind I ordered, magnesium glycinate. There, can you see? Nope. Oh, glycinate. There, maybe you can read that. Magnesium glycinate. And that is because it's magnesium that's connected to a bigger molecule called glycine. Glycine is an amino acid neurotransmitter in your brain that your body uses to help calm you down. And so if you are suffering from prednisone causing you insomnia, from prednisone causing anxiety, or other mood changes, this is the best kind because not only does the magnesium help stabilize your mood, but the glycinate does too. So it's like double whammy. Like it's just so awesome for you. Now this bottle, let's see, they suggest 1 capsule per day. So this is a 90-day supply and this cost, I think like $40. And so $40 for just this one ingredient alone. And like I got the best kind, like Pure Encapsulations, they're the best company of all. Like they're called Pure for a reason. They're the most highly respected by doctors and, you know, chiropractors and all the people who care to help you with supplementing what you're missing. So if that's, you know, $40, that, you know, that can add up pretty quickly. And I felt so strongly about magnesium glycinate helping people on prednisone that I actually invented a dietary supplement that not only includes magnesium and specifically magnesium glycinate, but it also includes all the other nutrients that prednisone depletes. Magnesium isn't the only one. There's at least 9 and potentially 15 other nutrients depleted by prednisone. And so I created this supplement. You just take 2 capsules in the morning and 2 capsules at bedtime, and it replenishes all the nutrients prednisone steals, not just magnesium. And you might think, oh, it's going to be 16 times $40, right? If this is 40 and there's at least 16 other ingredients. No, it's not that much. If you just click the link below, you can find out exactly how much it costs. And it's a deal compared to just this one ingredient alone. So just click the link below, go to nutrinize.com, find out how to replenish the nutrients that prednisone steals. Because if just magnesium alone can help with all of those side effects, what do you think this could do when it's replenishing all the nutrients that prednisone is stealing? Go to nutrinize.com to find out more. I'm Dr. Megan, your prednisone pharmacist. I'm here to help you not just survive prednisone side effects, but thrive while on prednisone.